I know brushing is another huge struggle with parents.
Yeah,
It's
and
something I
sing
never
while
get.
brushing.
Yeah. With nitrous oxide, when they're lying down and that or nitrous oxide is working, they have no idea of time.
They talk about, oh, we ran away from the dentist. कि उन्होंने हाथ पकड़ लिए थे.
The damaging part is giving the milk ad libitum, as in when the child, just because you're used to giving it.
Patients and mothers and parents at large ask that, is a manual brush better or a rotary brush better?
Right. A lot of parents asking, what is this cavities? What are these dental cavities?
Yeah. We also do a lot of fluoride, like topical fluoride applications in our clinic.
Right.
Which we do once in every 6 months.
Right.
So, do you recommend that for all children? Yes.
Because if the cavities or anything starts, they initially start off just as a white spot.
Okay.
So that usually gets overlooked by
Yeah,
parents. So
that's
they only come across when it gets much more advanced, when it's more jarringly brown or black.
Yes.
That's when they
Yes.
come into us.
Yes, they do
But
come
the
in when
initial
it's brown.
cavity is,
Yeah.
you must
Yeah.
have seen, I'm sure you
Yeah.
dry. So you
Yeah.
can only make that out by drying. So when you
Okay.
dry it, then the refractive index or the color of the tooth changes. So then you see this white spot. So once that happens, that's when the cavity is initially starting. So that can be reversed with fluoride only.
So that is a good point, because that the parents can take back, that they need to basically dry the teeth and check if there are any white spots which are
yes.
there, because that is the starting of a caries.
Exactly.
Starting of caries. And the risk assessment is something that the dentist or a periodontist will
Any
do.
of us can do it, even a general dentist, and you have softwares available today where you can just feed in the data and it gives you like a karyogram, it's called.
Okay.
So it tells you, or you just get just go to any pediatric website or just put caries risk assessment form,
Yes.
simple questions, and it categorizes your child. You can get them freely from the American Academy of Pediatric Dentistry, because they want everybody to be able to do it. See, we are not so many pediatric dentists, so we need everybody to get on board of this. And basic prevention, everybody can do.
Yes.
We don't want children to have cavities. So there's no only pediatric dentist can do this or somebody should not. So get the form and you can risk assess if the child is in a medium or a high risk. So the risk is based on past disease, or if the child is brushing, not brushing, using a fluoridated toothpaste or not. So they're like questions. So on that categories, they've made the children into a basic criteria. If a child has a white spot lesion, is only 1.5, 2, or a single cavity already at the age of 2, which we see all the time in dental aesthetics.
Yes.
So those children, we have to monitor them even more. So sometimes not even twice a year, we put it even 4 times a year, fluoride monitoring, the higher risk, to control the cavities initially.
Yeah, because I have heard people saying that why इतना छोटे बच्चे का root canal क्यों हो रहा है?
exactly.
So that's because of nursing bottle decay. The early white spot which you just said was not seen. Then it reached the brown spot. Then from the brown spot it reached the dark brown spot.
Absolutely.
And when the child started saying that his teeth started breaking down, and then the child started saying that I'm having pain, now you've come to the dentist. So you have failed from your end, honestly. Like will not even
Mix your words,
mix my words over here. You have failed from your end, and then you're coming and asking कि why are you wanting to do ये तो दूध के दांत है, ये तो वैसे ही टूट जाएंगे. And if you tell them that it's because of the bottle, they in disbelief. ये हो ही नहीं सकता, ये तो सालों से हो रहा है. Like, so why is it that, before, if we do believe what they're saying, that before it was not as bad as it is now, but it is what it is.
It is, yeah.
So is there any reason why it's because...
So I'll start off by, the funniest thing is that very good point you brought it, दूध के दांत. That's a question that we all get. The first thing, तो दूध के दांत है, गिर जाएंगे, इनका क्या करना है? So, funnily so, in the US, 51 million hours are lost every year because of dental pain. So it affects academic performance to that level. This is not me. This is the National Institute of Health saying it. And in India also, we don't have national level statistics, but lots of studies collaborate the same. So many hours are lost because of pain and dental infection. And as a pediatric dentist, and our specialty is actually called pediatric and preventive dentistry.
Yes.
So we believe in prevention. We don't want to do root canals for your children.
Yes,
we want them to come in at age 1, come to dental aesthetics, come enjoy, sit and watch our TV, put some fluoride. Make your child have a great experience so that they come back every 6 months, get their fluoride, sail through childhood without any cavities, and then get whatever orthodontic intervention or something, which is what most kids need today. Do that. We also don't want that. So we want that prevention to work. So we were talking about
We were
you were
talking
saying about why it happens now.
Yes,
So
yes.
what's happening is refined foods has increased.
Yes.
Fluoride has gone down. People are not using. I mean, earlier also I don't know how much brushing was there, but the main thing is the refined foods
Yes.
and the accessibility to all of these refined sugars.
Yes, yes,
And parents are much busier, and a lot is happening with the screen time.
yes.
That's a great topic actually. So you must have noticed all the kids who
Yes.
come where they go to the screen.
Yes.
I don't know, does Ivan do this? Like
No.
keep food in one corner, or any children that you know in your family or something?
I did remember, like, when I was small, my cousin used to do it, but thankfully, my
So
son
what's
doesn't.
happened watching the screen now, what I've noticed, there's something, it's called pouching.
Oh,
So all these kids are taking food, keeping it in one corner, it's called food pouching. And I get so many kids, so you'll see this very peculiar scenario where only one side there'll be a cavity. Baki sara muh theek, and one side there'll be one cavity because that kid is watching screen and food is sitting there, so it's leaching out nicely all the acid, and that area is getting the cavities.
Yes.
So that's becoming very,
Yeah,
because
that's
all kids are
very,
watching, including my nephew, I know, he also used to do that, and then told my sister, to stop, and now she has. So that pouching has become an issue. So that's increased.
Yeah.
The teeth, also generally the children are being born because of living in Delhi and all these metros. The food is not so pure. So the kids' teeth are itself not formed that well. So sometimes it's not the parents to blame. A lot of parents get guilty.
Yes.
So I always tell them sometimes there's something called enamel hypoplasia.
Yeah.
So the teeth are not formed so well. So they break down much faster than the earlier teeth used to.
Okay.
So a lot of parents say, us bacche ko to nahi hua, is bacche ko ho gaya.
Yeah.
So that's because the quality of the teeth also. So that again comes into our risk assessment.
Yeah.
When the child comes in, if we see that
Yes.
initially,
Yes.
so then we will make sure that we take that child more with care. That's why coming in early is the key.
Okay, got it. Even with screen time, because again with Ibhan, I did not give him the screen for till almost when he was 1.5 or 2 years old. I can't really remember, but now also it's limited. It's
Right.
like, okay, you can have it for dinner, so he looks forward that
To that.
okay, after dinner I'm going to see the screen, and
great.
this is definite. Like, this pouching is a new concept for me also, but he thankfully doesn't do it.
Yeah.
So it's just that the screen is for this much time, half an hour. You're gonna finish your food in that half an hour, and we're done, and then
Yeah,
we shut it.
great, good,
So
yeah,
that is
reinforcing that,
just helpful, because it is not possible. Like, I again, which I was talking about, that realistically I will have to work around my way. I can't just be like, okay, now this is out of the window. This is not going to happen.
True,
So
yeah,
you
it's
just
not
need to
easy.
find the balance between that.
That's probably what life's about. Balance.
Yeah, balance. So when these children, when they move into like teenage years,
Right.
and there's a lot of mixed dentition. There are also teenagers who are still thumb sucking,
Right.
and there's a lot of orthodontic intervention which
Needs
you
to
were
be done,
you're talking about, because with thumb sucking, because of the pressure from the thumb, the palate goes up and it
Exactly.
becomes narrow,
Yeah.
and there is constriction in the upper jaw, and then there's crowding. So thumb sucking also leads to
It's a definite
orthodontic
thing.
work.
So thumb sucking till about 3 to 4, we say it's okay. We try to dissuade it.
Okay.
So, but after that, definitely needs to be taken care of. So we have a lot of interventions. We have habit breaking appliances. So we start off with always a psychological approach, where we give stickers and incentives, and try to get to the root cause of it. So we have certain ways that works in lots of kids. Some of them just outgrow it when they go to bigger school.
Okay.
But the ones who don't, then we have habit breaking appliances like a tongue crib, or like a like some kind of punishment, kind of a rake kind of appliances. Now actually, because of these aligners, they can be utilized early in. So earlier it was a misconception that all your children's teeth have to fall out.
Yes.
Only then we'll get braces. So there's no such thing anymore. The American Orthodontic Association, the AA, also recommends to get your first screening done at the age of 7.
Okay.
So once all your children's teeth have fallen, we can do some certain interventions when the child's got children's teeth also.
Yeah.
So if we see that, we have certain appliances for that, myofunctional. So we call this, every second day I get a parent nowadays, especially in Delhi, where, they have tooth grinding, or they breathe with their mouth open at the youngest 4 or 5.
Yes.
So that's a constant query. So we call that sleep disordered breathing, or SDB as it's called. So it's an airway issue. So what's happening in Delhi a lot also because of the pollution, kids have like congested, the adenoids and tonsils are overgrown, so they don't breathe so well. But that leads to a habit of keeping your mouth open. So even if that gets okay, it still continues. So then we have to intervene
Okay.
early.
And we intervene in the form of appliances.
So we have these prefabricated appliances made by this company called MyoBrace. So so I'm not endorsing any product, but these companies have these plastic appliances that you put in, or kind of aligners that kind of similar like aligners. So you put them in and stop that from happening. Plus, we have something called OMT, which is a big rage right now. We're doing it everywhere because we're realizing that fixing the dental issue is not the main thing. The problem is the breathing, which then later leads to, dark circles around eyes. They don't sleep so well. They have difficulty focusing in school. Then they obesity. A lot of issues have been linked to this sleep disorder,
Sleep
breathing,
disorder,
or airway
of
issues.
course, yes.
So earlier, I'm telling you for myself, I'm sure you might have heard of also, when I was earlier, before I was aware of all of these things, any child who was grinding their teeth, we said they've got worms. So we used to send them for deworming.
Yeah.
Because that was the first relation that was found.
Yeah.
But now we know that it's actually a reason because you're trying to breathe,
Yes.
the jaw comes in front, and that what causes the grinding. So the grinding is actually a response for the body to gasping for air when they're sleeping.
Okay.
So now we know we have to, first thing is to get an ENT clearance. So we have a link up with an ENT. So he kind of makes sure that it's not because of some kind of obstruction. Because then we cannot give any of our appliances because they won't work.
Yeah.
Because the child cannot breathe naturally. So any obstruction has to be removed. Then because the habit is there, we try to train them with some kind of exercises, which are called oral myofascial therapy. So there are a whole bunch of exercises, like you pull a button, then make clicking sounds, place your tongue, swallow in a certain way. So that's another thing that we do now, as young as 4 or 5, or even younger. And then you have aligners, which you were probably doing them more than I am right now. So I would,
for adult patients, they are like teenagers.
But now you can, aligners are there for kids, even for advancement and all of that. So you can start in early,
Yeah. Even now, there's when like it initially we used to be like when all the milk teeth are going to fall out, then we are going to do something. But now there's phase 1 orthodontics and there's phase 2 orthodontics. So there is phase 1 ortho in which you can actually work around the child's teeth, and you do not need to work so much in the phase 2. If you like kind of make sure that the phase 1 goes till the mid level, and then we go to phase 2.
So we get a lot of teenagers nowadays. Everybody's playing sports, and everybody's so into it.
Yeah.
So we've been working on getting mouth guards going and all of that. So how you can just explain it to people. How do we go about, and why should we use mouth guards?
Yeah. So mouth guards are very important because they protect your teeth. I don't know if they fabricated mouth guards or whether there was less awareness, but now even we get it from the school. Like the children come from school and they say that the school is asking us that we need mouth guards. So it's a very easy thing, honestly. We just need to take impressions, and now we have the digital scanner, so we can just scan it and we can send it to the lab. And then they fabricate guards, which is easy to slip on. They are obviously customized because they can't fit every student. They are not prefabricated, and they are also in different colors. So the student or the child can just say that, okay, you know what, I want this color, and they're easily like they can easily wear it and remove it.
Absolutely.
So that is again like one of the game changers for sports injury, because what used to happen before is that we used to get patients who were playing sports, and like either they were playing soccer or football, and someone's leg hit their face and they broke a tooth. So we had injury. The child's tooth has fallen out on the field, and they've got the tooth in their hand. What should we do about this? So all those things are prevented. Also, I feel that a lot of parents don't know that if there is an injury to the tooth, supposing a child is wearing the sports guard or not, and if there is an injury to the tooth, what to do? Because at that point of time, there's so much panic.
Absolutely.
So I feel that they should at least know that the tooth doesn't need to be scrubbed clean.
Exactly.
They just need to be washed under the water,
tap water, and then carried to us in like milk or coconut water. But
or the spit of the
or
child.
Keep it in the corner of your mouth also and get it.
I do even say like they can just get a plastic beaker and they can just like spit inside it and just put the fragment.
So that is another area that really needs to be the initial, because I'm actually working very closely with Indian Society of Dental Traumatology. So we're making this whole awareness campaign, because it's most of this happens to younger children, less than 13, and you get them all the time in the clinic, and then aesthetic concerns and the whole cascade that follows.
They also do not know that if the tooth is fallen, so if it's chipped, it also can be bonded back to the fragment, chipped tooth, the fragment. And but all this needs to be happening in the first 24 hours.
Absolutely.
You can't.
Time is very critical.
30
critical. to 90 minutes is critical.
And also if the entire tooth has come out of the socket, also it still can be put back into the socket.
Absolutely.
Provided you come the earliest possible and not scrub it
Yeah.
out
Or
from
get them in like kagas, like they
yeah,
get.
yeah. It needs to be
Actually,
hydrated.
Dr. Ubre just sent me this patient recently
Yeah.
from somebody had texted him. So they had sent a nice picture where they had safely put the teeth inside paper,
Oh
rolled it and
God.
sent him a picture that we are coming to Delhi.
Yeah.
So should we put it in? So sir had
Yeah.
sent me a thing, saying that iska kya kar rahe
कर
hum?
सकते कुछ because if the tooth is dehydrated, it is
Yeah,
not going to go.
absolutely, absolutely.
Even if the tooth is put back into the socket, it obviously needs regular checkups and regular
Yeah.
follow-ups. Also, it's not that it's put and now you forget
I think we should
about
make
it.
a whole awareness, like a
Yeah.
video about this trauma thing,
Yeah,
and put
yeah.
it out there
Yeah.
after this because
Yeah.
it's a great, it's a
Yeah.
topic that really requires.
Yeah.
It can be again, it can be life, life changing for them.
Yeah.
Losing teeth in front, how it
Yeah,
looks like,
yeah,
right?
yeah.
So if it can be prevented, it's such a
Yeah.
great service
Yeah.
to do, and you are linked with all those NGOs and so many
Yeah.
kids.
Yeah.
So it'd
They
be great to put up a
routinely,
poster
yeah.
there, or
Yeah, they routinely because they in NGOs these
Yeah.
especially in boy NGOs. I mean, I'm saying this, but they have fights and they break their
Yeah.
teeth and they come. And very recently, one of the kids had met with a bad accident and like front 5 teeth
Oh my God.
are out like for life. And
Uh.
he's what 17, 18, and now like they go to like if generally people would want ki chalo bridge kar do.
Huh.
So then you lose like the side teeth also, then they are also shaped down. So we very recently
Oh, yeah, you did that. I
replaced the
saw that. Yeah,
implants,
yeah. That was
for
really good
that.
service, yeah.
So just 3 implants and like 5 teeth are in place, and we could actually give him the teeth on the same day of the 24 hours after the surgery. But he was living like that for a month almost, with like 5 front teeth out, and I was
Must be in
just like,
tears when you sorted it out for him. Huh? It's such a, I mean, that is like the most fulfilling thing. It's suddenly when you see their happiness that you, and so gratifying for you to, do that, and
it's
totally
quite
free, right? You
rewarding.
did it
Yeah,
like
yeah,
totally.
yeah. We don't charge the
Amazing,
patient. Yeah, it's
amazing.
quite rewarding that phase. Yes. Also, like young patients come, like our dental aesthetics patients, and we've seen them coming to you, and there's this, and suddenly they're like that, 18 years old, and they're like, yeah, we want to come, but they still want to come to Dr. Nikhil only. They're like, no, he's Dr. Nikhil. Now, even if we are adults, now we still want to go to Dr. Nikhil.
That becomes a bit of a thing. But we are all equally cool. I mean,
Yeah.
if I was to trust anybody, I would have. It's
Yeah.
nice that they continue in the same.
Yeah.
That's the advantage
Yeah.
of being in a group practice where
Yeah.
we have people that you trust, you can take
Yeah.
over.
Yeah.
And they also trust you because
Yeah.
if you're telling them, for
Yeah.
me, it's an easier transition.
Yeah. Yeah.
It's tougher when you have an exclusive pediatric setup.
Yeah.
Then it's harder to refer to
Yeah.
somebody. But at least they feel the same familiarity,
Yeah.
the same people,
Yeah.
And
Yeah.
sir is always creates a bond with everybody.
Yes.
So he's, they already recognize him.
Yes.
But since kids, he's been playing jokes with them and
Yes.
daan nikal dunga
Yeah, daan
and all of
nikal
that.
dunga.
And his
All-time
favorite
favorite
hand holding,
joke, yeah.
haath chipak gaya wala
हाँ,
trick.
all-time favorite joke.
Yeah.
But these kids now, when they start becoming older, the grooves of their molars become very deep.
Yeah, yeah.
And that even if their brushing technique also is changing at that
Right.
point of time.
More independent and,
yeah.
yeah.
And their like lifestyle is also changing, and their hormones are also going off. So and then even if they're doing everything, the cavities are increasing.
Right.
So for those children, you do sealants, right?
Yeah, sealants. So most of the time when I get the kids, the first molars come in at 6, the 6-year molar. So that I definitely do sealants.
Okay.
The whole concept of sealants, they're basically like a coating.
Okay.
Like how you have your window pane and they put that putty on the side to block the excess thing. So this blocks the grooves in the of the tooth, which are most amenable to getting cavities. The fluoride takes care of everything else.
Yeah.
But the brush, because of the thickness of the brush, doesn't reach the bottom of these fissures, as we call it.
Yes.
It's called a pit and fissure sealant. So it basically seals the pits and fissures on the teeth. So the fissures, the grooves that are there on top of the molar teeth. So we usually seal those. Sometimes we do them even for less than 5, not permanent teeth, but children's teeth also. Where we see they have high caries and their grooves are very deep.
Yeah.
Because that's genetic, how they form, right?
Yeah.
So the initial 3-4 years of that tooth coming in, because that tooth is actually, that permanent molar takes about 2-3 years before it comes out completely. So we try to seal it so that it, doesn't get cavities. That's the most amenable in the first 3-4 years.
Yeah.
Because it's not strong enough.
Yeah.
And then older kids, as you said, which you see more than I do. So those also in permanent second molars, once they come in by about 13, you can, put sealants, especially if they're getting orthodontics and all done.
Yes.
And as habits change, as you said, they become more independent. That's a great time to put in sealants. Sealants are about 30 to 40% efficacy in reducing cavities.
Cavities.
Sometimes they pop out a little, but you can always just redo them. Some parts.
Yes.
But the remnants of that sealant still prevent cavities because it
Yes.
doesn't let the food,
Yes.
the bacteria grow there.
Yes. And it's completely safe. It's a very easy procedure.
Simple.
There is no drilling. It's just that the grooves need to be sealed. So it's just bonded and we sealed and we cured it very easy. And it's very tolerant to the patient also and for the parent if they're accompanied.
It's a very high value treatment
Yeah.
for what you're doing for such a simple
Yeah.
procedure. The kind of protection it's offering you, it's totally worth
Yeah.
it.
Yeah.
Because such a simple procedure, but it prevents cavities, and those are the most common areas where it happens.
Yes.
Initially.
Yes.
So it's a great, it's a go-to. So fluoride varnish, fluoride topical application, and sealants is what we have to prevent. And they prevent 50% almost. So it's as a combination of the two, maybe 60 to 70%.
Yes. A lot of patients that sometimes feel like not a lot of patients, but some patients feel that, why is this dentist or the periodontist like selling this treatment to us? We don't need to do fluoride. They're trying to just
Make money.
make money out of it. But they don't understand is that if they are investing this much right now, they will probably not need to invest for like
Exactly.
a big, huge filling after 5 years or like a root canal or like a extraction.
Absolutely.
That cost to cost, they should understand that they need to invest a little. It's just basic cleaning of your teeth, just checkup of your teeth,
absolutely.
fluoride varnish, and it is going to keep the mouth healthy. You might not even need dentistry.
Absolutely. That's our aim.
Yeah.
I don't know, this whole perception of thinking that dentists only want to give injections and hurt you, and the scary perception they made about us. We want to change that completely. We don't want that. Come in early, let us do our job. Listen to us. We are all talking. So we are not just talking random stuff. This is all evidence-based, time-tested. We've all studied. As a pediatric dentist, I've studied 3 years extra apart from my BDS, and we're trained to do this, and we follow evidence. We're not just doing something randomly because the long-term gains that you're getting from this is a child who's happy, has no cavities. I mean, you do get your vaccination, right? You go to a pediatrician, the child cries every time you go there, most of them, and now pediatricians also improve their ways. I keep seeing lovely videos of them doing it. So it's just like a vaccination, right? It's a tooth vaccination. A fluoride varnish and a sealant is nothing but a vaccination to prevent cavities.
You also talking about vaccinations. I just remembered that you have this cool sleeve of dinosaur or crocodile for that injection, so that the child doesn't even see the injection. Like, what is that?
So it's like because we have the injections look really scary, right? So you have like a crocodile that goes over it. So when it's lying around, they don't really know. So along with that, with our nitrous oxide, in the clinic, so it just totally disguises. They don't know. They don't see anything coming. They think it's like a toy. And you make them play with the sleeve before. So they think that it's just a toy that's lying around. You put a little story around it about how this crocodile is going to come and eat up all the germs which are there. So you build everything in pediatric is storytelling. So you have to sit and create this whole story that you can relate to. So we actually call it childrenese.
Oh,
so like the language that we use euphemisms. So like we don't call a X-ray and X-ray. We call it a camera. We don't call the topical anesthesia. We call it tooth jelly. So we have to come down to the child's level of understanding. If I say all these big things, like they won't understand. Putting a rubber dam for you. So we say it's a raincoat.
Even suction is like a straw. The light is like we have to inform the patient that now we will switch on the light, and there's a magic light, and so that also really helps with ease, because suddenly if you make the child sit and you put the chair up and down and you switch on the light and you have the instruments going inside the mouth, anyone will get scared. So it's a lot of information that we are like, okay, now this will happen. And I have tried to do these tricks in which I say that the child is sitting, I'm like, you like how you do a lot of magic. We are going to look into the magic tricks that you also do in the later segment of this, because that is like expert work. But whatever little I can do is that, because till the time I schedule an appointment with you, I'm like, let me just try to make this child comfortable. If the child is comfortable, I am going to be comfortable. So I always tell them that, you can do a magic trick. So say up. So the child says up, and then push the chair up, and the chair starts going up, and then you go down.
That's a good tip too. That Hiral Bhaiya does that a lot. Earlier we used to have the sensor wala light. So that used to work really well. So you just do this and they used to love keep playing with the light.
So Dr. Nikhil, you do such fun activities to ease the kids in our clinic. So can you demonstrate a few, because they're quite interesting and fun.
So let's start with this one.
Oh. Oh, wow.
She'll take it out
Yeah.
from here again. And put it by
Wow.
here, take it out. Okay.
That's
So that's one.
amazing.
So I won't reveal the trick, but then this is the one that all kids fall for. So we start off showing
Yeah.
them the color book. Okay. Can you see the color? So what you wanted to do is now tap it really hard and get rid of the color.
You have to say abracadabra,
Yes, the magic
abracadabra.
words.
Yes.
And only brave kids can do it, huh? So you tap it
Okay.
harder.
Tap it up.
Oh, good one. Okay. So we got rid of all the color. So now we're going to get some color back. Okay. So what I usually do is get some color, get the parent to put the color. Go ahead, put some color. And do the magic words again.
Abracadabra.
Cool. So we
Oh,
got the color back.
yay.
Okay.
You got the color
So
back.
this one really
Yeah,
works.
this really works. Yes.
Okay.
Yeah.
So as I said, I can erase it and show it to you again. Cool.
Wow.
This one. This other one I need. We usually after when they're partying. This is the initial, breaking the
Yeah.
ice
Yeah.
routine.
Yes.
So once they get that, as I said, it gives them control back.
Yes.
Makes everything curious. So they wait for the treatment. Once it's done, then we
Yes.
teach maybe some of them which are a little more thing. I've given so many books of this away.
Yeah. Oh.
Afterwards, you teach them.
Yeah.
Every single parent asks for a thing. So this is
I'll
like
help
the
you.
balloon animals. There's this book that comes, and so we use those all the time. So this is the balloon trick that we usually do. So in the clinic, I usually use the 3-way syringe to
Yeah.
blow this up, but right now we don't have it. So I'll use the pump that comes with this. You can skip all this part. I'll show the ending.
Yeah.
So these are the balloons we make, as we were saying. So so we choose the color, everything, and then we start them guessing on what we're making. So can you guess, Dr. Shida, what this is?
It's like a rat.
Rat.
Balloons.
So that's it.
Yeah.
So that's it. It's for you.
Oh, wow. Thank you. Thank
Give it
you.
to Ibhan.
Yeah, I will. Thank you.
I get a lot of parents mothers who are there who are pregnant with their second child.
Yes.
And there's so many precautions and stuff that's to be taken, as we discussed earlier also.
Yes.
So since I don't really deal with adults that much,
Yes.
so you have much more. I send them all to you.
Yes.
So
Yes.
can you give us some tips of mothers who are pregnant?
Yes. So actually, this is a very, very important topic, and I feel that there is not a lot of weight which is given to it now because of social media. I'm glad that we've tapped into this because it is very, very important to actually get screened before trying to conceive. Because nowadays we are more aware as a generation when we want to have kids and like how do we want to raise them. So I feel that this topic, and now fortunately a lot of patients are coming who are going in for IVF treatments. They know they're going for IVF, so they're like, we want to just clear our dental work.
Right.
So this is like, okay, for people who are going through IVF, but also people who know that they are planning to have a kid. It's very important to come for a dental checkup. Why? Is because firstly, oral hygiene needs to be monitored. Your hormones go up and down when you're pregnant,
Right.
and it leads to something called as pregnancy gingivitis. So
absolutely,
there is gingivitis means inflammation in the gums, and suddenly the gums will start bleeding. They'll become really swollen, and the woman won't understand what is happening.
Right.
So it's very important to firstly get that clear, like no, and it's nothing but just cleaning, regular cleaning. If there is any standing periodontal infection, that means gum infection, which is there, they need to be more careful, because if there is already a chance of periodontal infection in a woman, it is only going to make it more pronounced when you're pregnant. Also, when you're pregnant, there is a time frame when it's a safe period to actually get any treatment done, and generally whatever treatment we would want to offer is just cleaning, honestly. So in the second trimester, when between 3 to 6 months is which is a safe period to get your cleaning done, which I recommend to women who are pregnant, because they have probably not come before. Sometimes cases come in which there was a very bad infected tooth which has suddenly started causing pain, and we don't want to extract it at that point of time. We don't want to give unnecessary medication and antibiotics while the patient is pregnant. So the clearance of disease in terms of whether there is a cavities, whether there is any root canal which is required, extraction should all be done before you before you conceive.
Right.
Also, if the oral health is not good up to standard, there is enough studies proving now that it can lead to preterm, the birth preterm.
Absolutely.
That is the key. So if you are healthy, your child is also going to be healthy, even if the child is not out of your womb at that point
Right.
of time. So that screening is there. Also, we do talk about lifestyle modifications when the woman comes to us, in terms of sugar intake, alcohol
Right.
intake, smoking, or any habit which is there, which might not be good for
Right.
the conception of the child, as well as enforcing brushing technique, because sometimes they're doing everything, they're brushing twice, they're rinsing, but the technique of brushing is not all right.
Right.
So we make sure that we train them in a way that the brushing is proper,
Uh-huh.
so that the mouth is healthier. Because as a mother now, I understand that if when you get pregnant till the child is almost 1.5,
Right.
you won't get so much time to honestly go to a dentist.
that,
So
true
it's just better to keep the clearance before you get pregnant, and then once in the second trimester, and then you can come probably after 8 months
Right.
or so. So that is my 2 cents of wisdom
No,
to
absolutely.
people who are
Agree
trying
with all that.
to.
So, because of this topic, I actually remember. So, what you're saying, oral health. So, we have this terminology called window of infectivity. So, we were talking about caries, why it happens more.
Yes.
So, this was that point that got left out. So, since we're talking about mothers, so newborn mothers, right? So, if their teeth are, if they have cavities which are untreated, so there's something called window of infectivity, which is the initial period when the child is there, the first few months, from 6 months to about 30 months. So, any bacteria that's in the mother's mouth, that's where the child gets the bacteria from. So we call it vertical transmission. So anything that you're blowing the food, or when they're breastfeeding also, or when they're kissing the child on the lips,
Yes.
all the saliva is full of bacteria, which then transfer to the child. And that bacteria that's bad, not treated, if the mother's got bad oral hygiene or cavities which are active, that bacteria is much more stronger, or virulent as we call it technically. So they go into the child, and that poor child, when the teeth come in, because the child is born sterile.
Yeah.
When a child is born, the oral cavity has no bacteria, it's sterile. The bacteria colonize from the mother or the caregiver. Most commonly the mother, in it,
Mother is
how
the
it is,
caregiver,
unfortunately. I mean, that's
Yes,
how it is.
it's
The mother gets blamed for everything.
Yeah.
But,
Yeah.
so that's where the bacteria
Yeah.
comes. So that's why it's
Yeah.
very important what you're
Yeah.
saying
Yeah.
to, take care of that window of infectivity, and not kiss the child or share utensils.
Yeah.
In fact, in the West, they have this big poster where there's a child that's saying, "Don't kiss me," because that's where the bacteria comes from,
Yeah.
especially if the mother has high caries.
Yeah.
So that's another reason when the parents say that why do they have cavities? 9 out of 10 of them, the mother or the father or somebody or the caregiver will have cavities in their mouth. And that bacteria break down children's teeth faster.
So you have to have good hygiene to even kiss your own child. Yeah, which is a great thing to take back from this section.
Yeah, so that's another important thing that parents should remember.
So now before we move on, let's do a little bit of myth busting.
Done.
Because so many myths
yeah.
are there. So we'll move to the next segment. So the first question, do baby teeth need fillings?
100% they need fillings, because we need to keep space for the permanent teeth. They help in chewing. If we lose them early, then there's going to be no space left for the permanent teeth, and they provide function, and they're essential for for the till the permanent teeth come in. We have to maintain space. So that's a myth that they don't need fillings, and they're going to fall. But till then, if they get infections or caries or get infections, the child is going to be miserable.
Got it. Second question, why does my child get cavities even though we brush twice daily?
So that could be that your toothpaste is not fluoridated, so that that's a big reason, as well as pouching of the food, as I said. And if the teeth is already weak, then we need to assess their risk.
Third question, are X-rays safe for kids?
X-rays are definitely safe for children. I mean, the amount of radiation by an X-ray is less than that that you get in an airplane ride. So it's that minimal with the current ones that we have.
Shielding is more important.
Yes,
than X-rays.
we take all those precautions in the clinic.
Fourth question, is sedation dangerous in pediatric dentistry?
Not at all, as far as it's done in qualified and trained hands. So we're all trained with basic life support and pediatric advanced life support, as well as nitrous oxide is completely safe. If you mix it more, we don't do them in the clinic. I prefer to do them in a hospital.
Fifth question, do teething gels help? Teething gels?
Most of them have harmful chemicals, so they're of no use as far as I can say. What's better is to use like a damp cloth, keep it in chill tray, use that for teething, or you can use cold fruits, like carrot or cucumber to bite on. Those are much more beneficial. Those teething gels have harmful, chemicals in them which are more harm than good.
Sixth question, fluoride or non-fluoride?
Definitely fluoridated.
Seventh, when should a child start flossing and use a mouthwash?
So flossing as soon as the two teeth come in. Mouthwash specific situations, especially if they're going through orthodontic treatment or they are very high caries, but only when they can spit.
8th questions. Does braces always mean extraction of teeth?
Not at all. That was way back in the day. I've gone through it, but now we don't. We have many more better ways to do it, and probably don't even need traditional braces. We have aligners which are great. You don't even need extractions.
Last question. Root canal treatment is not age related. Can happen to the youngest of the youngs. Is it true?
Yes, neglect leads to that, and we do that almost on a daily basis, unfortunately. We don't want to get there, but yes, we have to. Root canal for children is absolutely safe. The technique is a little different from adults because, we have to take care of the permanent teeth coming in. But yeah, it's definitely there. We do it all the time.
So that is the end of the rapid fire round. We don't have any gift hamper to give.
This opportunity is good enough.
Yeah.
So, Dr. Shah, since you were talking about brushing, I think you're very used to doing those in your your Smile India camps and all that.
Yes.
So, would you like to give a demonstration of how to brush?
Yeah, definitely. You can get me the tiger, which
Our star.
star tiger. So this is really like a helpful tool which we have in the clinic, which we use very routinely in our Smile India camps also to reinforce brushing. So this is the tiger, and for kids and for adult, brushing is different. So when we talk about kids, we do a circular motion. So if the brush is like this, and I've kept this like that because the child is or the adult is going to be brushing like that. So we'll keep this as is. So we go circular. We go circular motion, 1, 2, 3, 4. And then we move it to the right side. Sorry, the left side. And then we move it to the right side. And we do the same circular motion. So we've done 4 times in the center, 4 times on the left, and 4 times on the right. And the same movement will happen in the lower. So 4 times on the left, 4 times in the front, and 4 times on the right. And similarly, we do it from the inside, because this is not a lot of people don't know this. They just feel ki samne se brush kar liya to ho gaya. So we need to make sure that the brush goes inside, in the inside also in the circular motion, like the way I'm showing. And then it goes on the upper teeth on the inside. So both outside and both inside of the teeth are important. Once all these areas are covered, then we go to the chewing surface, because this is where the food gets stuck. So we brush the chewing surface like this on the other side. And then we turn it up and we brush the chewing surface on both the sides. So this is the brushing technique which needs to be followed for kids. Now, when we move into adult brushing, or teenagers brushing, so this is the brushing technique that needs to be followed. So teenagers till adults, the technique is the same. So you take the brush and you keep it at an angle, and the gums towards the tooth, for the upper teeth, it needs to go down. So you move the brush 4 times down, similarly on the right side, similarly on the left side. And then when you go for your lower teeth, you take the brush and you go upwards, because you have to always go from the gum towards the tooth. So you go upwards, same on the left and the right, and again from the inside. So you go 4 times from the inside, gum towards the tooth. Similarly for the upper teeth, gum towards the tooth. Always check in the mirror whether the plaque is off, because mostly we just do it fast and then there's definitely some plaque left. We also go on the chewing surface the same way as we did for the kids, because that's also important. Food for adults also keep getting stuck. Mm-hmm. And then we brush the tongue. We can brush the tongue with the toothbrush also, but we don't need to put too much pressure on it. But we can also use a tongue cleaner. And lastly, very, very important tip for adults, whenever we're brushing the third molars which are there, because of the size of the jaw, the third molars are either come in different positions now. Either they're stuck in the bone or they're outside. But wherever they are, you need to close your mouth slightly so that your brush can go right till the back and then clean that area. Because mostly the cavities happen here in this area. The brush doesn't go there and the cavities happened over here at the wisdom tooth. So what we feel is that if we open the mouth as big, the brush is going to go as back, but that's not true, because the cheek is going to cover that area. So you need to close your mouth when you go towards the back and then clean the tooth for adults. So yeah,
Thank
that's
you
what
so
it is. Yeah. So it's a wrap on today's session. Today's episode was so nice, fun, and insightful. And thank you, Dr. Nikhil, for such a fun session of rewards and gifts and magic tricks and so much information for me and for the rest of the viewers. So see you guys on the next episode. Till then, keep brushing and keep smiling.